Different provinces around the country are also sending the help that they can. The Western Cape provincial government sending some rescue workers. Now the Limpopo Provincial Health Department also sending some people to that area. The MEC for Health in Limpopo is Dr. Phophi Ramathuba. MEC, good afternoon to you and thank you for your time. What kind of help are you sending to the people of KZN?
Afternoon, Stephen, and afternoon to all your viewers out there. As the Limpopo Department of Health, within our emergency medical services personnel, we do have the research and rescue team. We do have divers, and those are the ones who, immediately when we had the call by the president, as a province, they came on board and said they would want to volunteer to go and provide, especially in terms of the rescuing and also the searching of the remains of those who have perished, because they are quite experienced. We're talking about divers here who have even international experience. In the previous time, I still remember 2018, in the Philippines, they had also volunteered and go and make the intervention there. So that is what we are currently doing from the EMS side. But of course, there are other social relief that the province is coordinating. For instance, getting clothing and all that, it's also being done from a provincial point of view. But as a health, we felt it is quite important, especially noting that it's very difficult for people to find closure if they are not able to find the remains of their loved ones and provide them with a befitting send-off. So it's going to have a long-term psychological and mental health impact on the families, those that are remaining. They might not even recover for that if indeed we fail as government to work together towards helping them to recover those remains.
I mean, everyone is trying to do what they can. Would you like to encourage other provinces to do the same? I'm sure they are.
We're saying that, but also, of course, if you look at us as a province, we are a resource-constrained province. We are a rural province or a small province, but we are saying the devastation that the people of KwaZulu-Natal are going through today, it can happen to us tomorrow. They are part of us. We're part of this. This is a one nation. We South Africans. It's our own people. If we can be able to send rescue missions to other parts of the world, why can't we do it at our own? So we say every South African, every citizen, they have got what they can contribute. We can't just look up to government alone and expect only the ministers to be the ones that are responding to that. Myself as an individual with my family, I don't need to go to shops to buy new clothes. You've got your own clothes that you have not worn for 3 months. That means you don't need that item. This is an item that you need to be handing over. You know you've got so many blankets that you have not even used in the past 5 years or 5 winters. Those are the blankets that you have got to go and give. So what we're saying is that all of us, we have got different and capabilities that we can do to help. So I am grateful for the team of the EMS that when we raised this and when we had the call by the president, they immediately raised their hands and said, as difficult as it is, risky as it is, but this is a mission that we are prepared to say, let's go and save South Africans. This is not the problem for the people of KwaZulu-Natal. It's the problem for all of us as South Africans. As a nation, we must be with the people of KwaZulu-Natal. Hence, we're saying ourselves as a province, we want every single citizen to contribute whatever they can.
MEC, I must ask, I mean, you made the point that you're a resource-constrained province, you're not a big province, and that's true. You're able to do this and make sure that you don't leave anyone vulnerable in your province. You actually have the resources to be able to send some people to KZN without putting anyone in Limpopo in danger.
Definitely so, because the current of skills that we are sending is a very highly resourced, highly skilled, those that are able to go into the most dangerous part when we have got such even challenges in the province. These are the people who are able to dive to the Limpopo River and when we have got such challenges that are happening. These are the people who are going up the mountains when we need to search. There are people that our police call upon whenever there is a serious challenge that requires them. So those are the people that we are releasing to go there. we are still confident that all our N1 roads and all our dangerous roads will continue to be mended. Our EMS, the remaining staff that is around, that's available, our disaster management plan, because you're quite fully correct, because this time around it's also a disaster period in our province, because it's an Easter holiday. People are coming here, some are going to churches, there will be visitors visiting our province. So we have to make sure that we balance. So as it is for now, whatever resource we are taking to KwaZulu-Natal will not leave the people of Limpopo at a disadvantage situation. Hence, we are calling upon, there are, of course, some people in the province who really do not understand why would we embark in this mission. And we want to emphasize to them to say, this is not the problem for the people of KwaZulu-Natal. It's a problem for all of us as South Africans. Tomorrow, it will be us in Limpopo. We might have another disaster different from the floods. We might have a drought. We might have another pandemic in the form of disease outbreak. We will expect the people of KwaZulu-Natal to release their resources, to release their doctors, their nurses, in case you will need such resources, because we are one country. So that is why we're saying, let's support them with whatever we have. It is not going to compromise the services in the province. We will continue to render services like we've always been doing.
And MEC, can I just ask, what we've seen with this disaster in KZN, I mean, it's so big, but it reminds us how important that planning for a disaster is. And you're the MEC of Health. I don't expect that you'll have flooding in Limpopo, but there are other disasters. You've pointed to another pandemic, but easily you can have big thunderstorms, you can have heavy rain, you could have something like that. Are you going to just make sure that your disaster planning is up to date in your province?
Yes, our disaster management plans, of course, learning from COVID-19 pandemic, which was, even though it was in the form of a disease, wherein it was led by the Premier from the Provincial Command Council, and also both the MEC for Coxta and myself were leading in terms of different streams that were involved. So even with the disaster plan, the province through Department of Coxta, we do have such a plan which involves all relevant departments in case we are hit by that. But we can't say we are 100%, because we always say whenever there is a pandemic or there is a disaster in the form of floods or any part of the country, we learn from that. Hence, you see us saying as a province, even though we have got limited resources, let's send our team. This is going to even assist them. When they come back, they will be completely different from what they are prior their departure to KwaZulu-Natal. They will be able to have learned how to manage a disaster of this magnitude. We have never had such in our province. And the biggest lecture or teacher of any disaster will be experienced. So for us, it's also a plus, because when they come back, they will be able to assist us in our planning to say, this is how you need to do, because our EMS personnel forms part of the broader disaster management as led by the Department of Coxta. So it is quite critical for us to go there, not just to provide the services that we can, but also to learn, so that as a province we become proactive and be ready for in case you have. We all know that climate change is still gonna be causing a lot of disaster across the globe. So it is quite important for us as government to now, when you start planning, you've got to be planning for also disaster management.
MEC, I really appreciate the time. Thank you. The MEC for Health in Limpopo, Dr. Phophi Ramathuba. Thank you very much indeed. Just one of the provinces sending help to KZN.